Okay, it is now 5 minutes after the hour. I want to welcome the 120 participants that we have here on the line today for the second webinar hosted in collaboration with Kaiser Permanente and the LACCD Health Benefits Unit. I'll begin by introducing the panelists here. We have quite a few. First off, of course, is our presenter, Julie Brady. She's a Kaiser Permanente Medicare Consultant. So this is something that she does all the time, doing webinars and answering questions on how to get that Medicare enrollment done correctly. Also, we have as a presenter today from the Health Benefits Unit, Karita Hughes, and she will be taking over the presentation in the last 30 minutes to explain very needed information on how to enroll for the first time in your retiree health benefits when you resign from the district and are ready to retire through CalPERS. So that's very important for you. We also have here today Sunny Smith, who is one of our key wellness partners. She is the regional territory manager for LACCD with Kaiser Permanente, and a very, very, very strong wellness partner to help me bring these type of webinars with expert presenters forth. And so I really appreciate all that Sunny has been able to get into our hands here for the LACCD community. Also on the line is Leo Costantino. He is our risk manager over the health benefits unit. He has oversight over the total wellness program as well as the EAP program. And we are so happy to have him a part of our team and as our manager in the health benefits unit. Also from the Health Benefits Unit is Sharday Jackson, as well as Sonia Sanders, and I'm so thankful for them being on the line here as panelists. They will be answering questions left and right, along with Sunny Smith, related to your health benefits in the CalPERS retirement program, as well as information about the district's policies on how to get set up enrolling in the whole enrollment for Medicare, for CalPERS retiree benefits. There is a process through our district for everything. And so they're the gurus, I call them, as to what needs to be done. So feel free to send your questions in two particular ways. First, there is the chat room. But there is also a Q&A. If you look at the bottom of your screen, you should be able during the webinar to send questions as well. And all of us will be looking to see how we can get those answers to you quickly. With that, I'd like to first ask Leo to please greet our participants. We're up to 130 now. And then I will turn it over to Julie to introduce herself.
Great. Thank you, Catralia. Thank you, everyone, for joining us. It's a new kind of format. It's a new world, but Catralia and Health Benefits Unit and our esteemed partners at Kaiser have joined us in this new format. So we appreciate your willingness to try something new. We did this last week to great success, and so we're hoping for another wonderful, informative session. So let's take it away, Catralia.
Thank you, Leo. Now, Julie, would you please introduce yourself to everyone, and then we're going to take a poll.
Sure. Yeah, my name is Julie Brady. I'm a Retiree Solutions Manager with Kaiser Permanente. I've been in this role for about 8 or 9 years, and I do a couple different things. One of the things I do is usually in person. I go out to the various CalPERS agencies and do Medicare education for them. So I'll be presenting this Medicare 101 to you today. I also work very, very closely with CalPERS when there's any sort of new initiative, new Medicare regulation, system change, doing a lot of project management with them, making sure for Kaiser members, if you are enrolled in us through CalPERS, ensuring that you have the benefits that you are entitled to. But I do want to say that this presentation is strictly about Medicare. and how your Medicare works with CalPERS. So we're welcoming Kaiser members and non-Kaiser members. You're all going to come away with a lot of good information about Medicare. Thanks.
Perfect. Thank you, Julie. All right. I'd like for everyone, I'm going to set up the poll here, and I'll launch it now, but this is a pre-test to see how much you know. I'd like for you to take the next 2 to 3 minutes to complete this. The poll is now in progress. All right. So the questions were as follows. You can start receiving Social Security benefits, retirement benefits, as early as age 62, depending on when you were born. And that answer is born before 1943. We actually have quite a few people that were born, of course, after, but we did have 2% that were born before the year of 1943. Now, it was a fill in the blank for number 2. If you were born blank, you can start receiving Social Security retirement benefits at age 62. And so that answer would have to be, of course, born before 1943. 11% of you got that correct. Your knowledge base will increase greatly as you go through this webinar. True and false for number 3, you can typically get Medicare health coverage at age 62. And the answer is actually false, not typically. It is normally a special circumstance or born before the year of 1943. True or false, you can receive Medicare benefits even if you have never worked. And I'm excited. 70% of you said true, and that is indeed correct. Julie will talk more about the stipulations and the requirements and all that wonderful stuff during the webinar and expand on these things. And number 5, true or false, says everyone must sign up for Medicare health coverage at age 65, whether they are working or not. And I have a true answer at 71%. And I will say that is a question that has been brought to both Julie and Sunny and all of us in health benefits on a regular basis. There are some differences. I will say true is the right answer typically, but there are some things that we encourage you to do if you are still working. So I'm going to turn it over now. Thank you all for participating in the poll. This helps us to know your level of knowledge. And so I'm sharing the results now with everyone so that you can see it. And we're going to move on to Julie's presentation on Medicare 101. Please enjoy.
Okay, thank you. I do want to just do a little bit of housekeeping. If you can't hear me, make sure that your sound is up on your speakers. You also might want to mute yourself. That may help with any sort of background noise. And, you know, we're sort of in this new world of testing out various technology. So I do have my volume up as high as I can, and I'll try to talk clear, and I'm moving uncomfortably into my webcam so that everybody can hear me. So let's get started. As I said before, this is not just directed to Kaiser people. This really is going to be a balanced presentation, talking about the different parts of Medicare, how they coordinate with CalPERS into retirement, and then how you enroll. So I'm going to take about maybe 40 minutes. I want to wrap up shortly before 2. We do have people, if you want to put your questions into either the Q&A or chat, people will be answering those questions throughout the presentation. And then if we have a little bit of time at the end, I can take some questions then as well. So let's get started. So the basics of Medicare. What is Medicare? Well, Medicare is a federally funded health insurance program. It was established in 1965, and at that point, it only included Medicare Part A and B, and together those were known as Original Medicare. Medicare is administered by the Center for Medicare and Medicaid Services, otherwise known as CMS. So that's very similar to the IRS overseeing our tax laws and regulations. CMS oversees Medicare. Now, Medicare was never designed to be comprehensive insurance. There still are deductibles and coinsurance that you pay for your Medicare health services. A coinsurance is a percentage. So usually with Medicare, you're looking at an 80-20, where Medicare covers 80% and you cover 20% of the service that you get. Most people do not stick with original Medicare now. Most people are looking at something that's going to supplement Medicare or fill in the deductible and fill in the coinsurance for those services. And that is exactly what you're doing when you're looking at the plans that CalPERS offers in retirement. So when you are retiring, you're going to be looking at the CalPERS Medicare plans, and those plans are going to supplement original Medicare and close up the deductible and reduce that coinsurance. So keep that in mind when we're talking about the different parts and the costs of the services. So who can join Medicare? For this presentation, I'm mainly focusing on people who are 65 or older if they or their spouse are eligible for Social Security. So if you know that you've worked for 10 years or 40 quarters, and that does not need to be continuous, it can be over various parts of your life, or if you have a spouse who's been working, you can be eligible under your spouse as well. There's some other situations that are not as common where you can be eligible for Medicare. One is if you are disabled, if you're under 65, if you've gone through your 2-year waiting period and you're eligible for Social Security disability, you will be enrolled automatically in Medicare after that 2-year waiting period. If you are diagnosed with end-stage renal disease, and that is you either require kidney dialysis or you require a kidney transplant, you are eligible to enroll in Medicare upon your diagnosis. And then if you are diagnosed with amyotrophic lateral sclerosis or ALS or Lou Gehrig's disease, you are eligible to enroll in Medicare 2 years after that diagnosis. But for all of us in our virtual room here learning about Medicare, I am focused on when you turn 65. So we talked about original Medicare being Part A and B, so let's talk a little bit more about Part A. Part A is your inpatient hospital insurance. So this is when you are admitted to some type of facility, whether it's a hospital, a skilled nursing facility, hospice, or home health care. Now, Part A is considered an entitlement or an earned benefit. So if you have worked those 10 years or 40 quarters and paid into Social Security or Medicare taxes, you will not be required to pay an additional premium for Part A. So you'll be receiving that kind of quote unquote free for working and paying into Social Security or Medicare. There is still that deductible, there is still that coinsurance, but you will not be required to pay any additional premium for Part A. So next is Medicare Part B. While A was your inpatient coverage, B is your outpatient insurance. So this is any time when you are getting services, but you're not being admitted to a facility. So this is going to be your doctor's office visits, your specialists, going to see your specialists, your lab work, your radiology, durable medical equipment, MRIs, dialysis, and preventive services. So you're going into a facility, you're receiving care, and then you're leaving the same day. That's your Part B medical insurance. Now, while Part A was an entitlement or an earned benefit, meaning if you worked those 10 years or 40 quarters, you would not need to pay any additional monthly premium. Part B does not work that way. Anybody, once they're 65, can enroll in Part B, but they are required to pay a monthly premium. So I'm going to walk through, I know a lot of people when they see this slide, they immediately start thinking about how much things are going to cost. So let me just take a little step back with this Part B. You will not need to enroll in Part B until you have stopped working. So if you are going to work until you're 55 or 60, obviously at 65, you'll be enrolling in Medicare, and then you will be responsible for paying your Part B premium. If perhaps you've decided you're going to work until 68 or 70, you can delay the Part B premiums until you actually retire. Your coverage under LACCD through CalPERS is considered primary to Medicare, and you can defer enrolling in Part B until you're actually retired. Once you are retired, you are required to make sure you're enrolled in Part A and B, and that you're paying those Part B premiums. So just keep that in the back of your head. You don't enroll in Part B until you are done working for LACCD. So now let's talk about the cost of the Part B premiums. So the Part B premium is determined by the federal government each year. They calculate the cost of all of the Part B services, and it's a 2-year look back. And then they need to divide the costs among 75% to the government and then 25% across all of the people who are enrolled and paying for Part B premiums. So all of these premiums add up to just 25% of the actual costs of these Part B services. Now you'll see these boxes here. These are looking at your income as you filed your taxes. So on the left-hand side of the page, you'll see these are adjusted gross income for either somebody who's single, filing singly, or married, filing jointly. And on the right-hand side is for people who are married, filing singly or separately from their spouse. Now in 2020, they're looking at your adjusted gross income from 2 years prior, from 2018. So every year, the Part B premium is going to be based on a 2-year look back for your adjusted gross income. The base Part B premium in 2020 is $144.60. And that is for people who, as a single person, their adjusted gross income 2 years prior, so from 2018, is $87,000 or less, or as a married couple, $174,000 or less. They will be paying $144.60. Now also what you're seeing on the screen, we need to remember, is per person and per month. So if there are 2 of you and you're both 65 or older and you're retired, you will each be paying $144.60 per month. And you can kind of go through this chart and figure out where you are depending on your adjusted gross income. Let's take an example of a married couple with an adjusted gross income of $250,000. You're going to find yourself in the third line here. So as a married couple, it's going to be $289.20 per person per month. So a married couple with an adjusted gross income of $218,001 to $272,000, that Part B premium is $289.20. Just to kind of summarize, the Part B premiums can change each year. I believe last year the base Part B premium was about $135.40. This year it did go up to $144.60. We have seen years where the Part B premium stays the same. We have seen years where the Part B premium goes down. So it really does depend on the cost of services. You also will occasionally see some changes to these income brackets. Last year, the base Part B premium was for people who, as a single person, their adjusted gross income was $85,000 or less, or as a married couple, about double that. You can always find this chart on the Medicare.gov website. The Part B premiums usually come out in the fall. You will get in the mail from Social Security a worksheet that will show what your Part B premium cost is. If you're getting Social Security, it'll also tell you what your Social Security payments will be. And that is sent to you each year, so you're able to track. You don't need to, you don't need to go looking for this yourself. You will get this from Social Security. And then one more final thing, do remember, you're not having to pay this until you have retired from LACCD and you are no longer getting your health coverage through CalPERS as an active employee. Once you've moved into getting your coverage as a retiree, then you're responsible for your Part B premiums. So now I'm going to move into how to enroll and how to pay for your Part B premiums. So you have a couple different ways to pay. There is a little bit of a misunderstanding that Social Security and Medicare are tied together. They're not really tied together. You do enroll in Medicare through Social Security, and you can have your Medicare payments deducted from your Social Security benefits, but you don't have to be drawing Social Security in order to be enrolled in Medicare. So if you've decided you're going to delay enrolling in Social Security, obviously you won't have your Medicare premiums deducted from Social Security. You'll want to look at some different ways to pay for your premium. You can go online to Medicare.gov and pay with a credit card or a debit card. You can have your payment directly debited from your savings or your checking account. Medicare has an app on their website called Medicare Easy Pay that you can go in and pay, very similar to their online method. Or you can still mail a check to Medicare. Some people are much more comfortable with mailing in payments. So whichever way you choose is fine, as long as you make sure you continue to make those payments. Some of you may have heard of something called the late enrollment penalty. Now, this may be of concern for you, for those of you who are thinking about thinking about retiring after 65. Maybe you have a neighbor or a friend who is giving you some advice and suggesting that you enroll in Medicare Part B because you're turning 65. And you tell them, well, I don't think I need to because my coverage through CalPERS is primary, and I think I can delay enrolling in Part B. And then they start to kind of scare you with this late enrollment penalty. So let me kind of set the record straight on that. There is something called the late enrollment penalty, and it is a penalty for people who fail to enroll in Part B when they're first eligible to enroll. And you're first eligible to enroll in Medicare when you're 65. And that premium is 10% of the base Part B premium for each 12 months that you fail to enroll in Part B. So instead of paying that $144.60 per month, you may end up paying that plus $14.46 per month. It's not a one-time penalty. It is a penalty every month for the duration of your enrollment in Part B. The caveat here is if you have coverage that is primary to Medicare, you will not have to pay that Part B penalty. So your coverage through CalPERS is credible and it is primary to Medicare. So maintaining enrollment and getting your health insurance through CalPERS, through LACCD, means that you will not have to pay that Part B late enrollment penalty. So I do know of some people who don't, maybe are told that they need to enroll in Part B, so they go ahead and enroll because they're afraid of that late enrollment penalty. We're going to show you how to make sure that you can defer your Part B if you're working beyond 65, and then how you can go back to Social Security and show them that you've been employed and you've had health coverage through your employer, so that you're not going to get that late enrollment penalty. All right, so moving into how to enroll. So you're eligible for Medicare on the first of the month of your 65th birthday. And everybody has what's called an initial enrollment period. That initial enrollment period begins 3 months before the month you turn 65 and goes through 3 months after. Now, it's a 7-month window. I really want you to think about the 3 months before. So this initial enrollment period, this 7-month window, is a federal requirement that they give you. But we really want you focusing on 3 months before, doing everything you need to do to get enrolled in Medicare. Problems can happen, delays can happen, paperwork can be lost. If you were to enroll later, maybe sometime after you turn 65, your enrollment would not be valid until after your 65th birthday. We want everything to be lined up and ready to go when you're 65 rather than anything delaying. So there's a couple ways you need to sort of put yourself in the right bucket. You're either still working or you're retired. So for those of you who are already retired, either at 65 or before 65, it's simple. If you're getting Social Security benefits already, you're going to be enrolled in A and B automatically, and you're going to get your Medicare card, and your effective dates for Part A and B will be the first of the month of your 65th birthday. If you're not enrolled in Social Security, you will need to go to socialsecurity.gov and enroll there. You can either enroll online or you can make an appointment. Right now, the offices are closed, but you can make an appointment at a later date, or you can print out the paperwork and send it in. So if you're already retired 3 months before you turn 65, you can go to Social Security and enroll in Part A and B. If you're going to be working beyond 65, you can still take that initial enrollment window and enroll in Part A and defer Part B, again, because you're getting your health coverage through CalPERS. And we'll show you some of the paperwork in order to do that. For those of you who are retiring after 65, you get your Part A when you're 65, and then maybe you're retiring at 70. When you go to retire, you have what is called a special enrollment period. And again, I want you to think about 3 months before. So 3 months before you retire, maybe it's 3 months before the end of the school year that you're 70, you go back to Social Security, and then you pick up that Part B. And again, we'll show you the paperwork that you need to use in order to make sure that you're not going to be held to that Part B late enrollment penalty in a few slides here. Okay, so now we sort of change course a little bit. So we've already turned 65. We've gotten our Part A. Maybe we retired. We're thinking about retirement now. So we've gotten our B. Now we need to think about what we're going to do with it. As I said before, A and B together are known as Original Medicare, and there are deductibles and coinsurance. And so you still need to figure out how you're going to get your services and how you're going to eliminate the deductibles and some of those, the coinsurance. So you're either going to be looking at a Medigap plan or a Medicare Advantage plan. So the CalPERS plans that are offered to you are one of those two things. Both of them eliminate the deductible. So you will not have to pay money before that health insurance kicks in. Your CalPERS insurance covers you on day one, on $1, and it also greatly reduces the coinsurance for your Medicare services. So let me just show you on the next slide here. These are the plans that are available to you through CalPERS. Now you're going to want to go to the CalPERS website and research all of these different plans, figure out which ones are available to you depending on where you live, and which ones meet your needs the best. Which ones do your doctors accept? Some people prefer a PPO. Some people prefer an HMO. You know, these choices very much are individual choice. I'm not going to read through them all. I think you can all see them on the screen. The most common ones are going to be the Kaiser Permanente Senior Advantage Plan. That is a Medicare Advantage or Part C plan. Again, no deductible, and you're going to pay low fixed copayments. Then the next three are the PERS plans: PERS Choice, PERS Select, and PERS Care. PERS Choice and PERS Care are worldwide coverage. PERS Select is going to be across the state of California, and they are PPO plans. They are Medigap plans, no deductible, and very little, if any, coinsurance on the majority of the health services. Then the last one there is the United Medicare Advantage PPO plan. It is a PPO plan. It is a Medicare Advantage plan. They offer nationwide coverage for you. So I'm going to show you on the website, on CalPERS website, where you can go to look at all these different plans. You will be required to pick one of these plans when you do retire in order to maintain your coverage through CalPERS. All of the plans include Part D, as in drug, Part D outpatient drug coverage. So there's really nothing you need to know about this. The drug coverage is basically identical to what you have right now. So if you're with Kaiser and you stay with Kaiser, you will continue to get your Part D drug coverage through Kaiser. You'll continue to go to Kaiser pharmacies. If you are going to join one of the PERS plans or the United plan or the other plans, you will get your drug coverage through Optum Rx. There'll be no change in your copayments or the drug coverage that you have. What you don't want to do is enroll in another Part D coverage somewhere outside of CalPERS. Maybe your friend tells you about a great drug plan through Costco, and you look into it and it does seem great and it may be great, but enrolling in any other health coverage outside of CalPERS will jeopardize the enrollment you have through your CalPERS coverage. So you want to make sure that you're not enrolling in anything else other than CalPERS. The CalPERS health coverage you have will cover all of your A services, your B services, your C services, and your D services. So this next slide here, some of you may find that you're going to be responsible for paying something called the Part D IRMA, the income-related monthly adjustment amount. Technically, there's no cost for Part D, no additional cost to you. It's all bundled into the premium that the health carrier bills CalPERS. This is unfortunate. On top of that, that you may be billed directly by Medicare. You can see in the you can see overall the chart, the adjusted gross income, the brackets are the same as when we were looking at our Part B, as in boy, premiums. So it's going to be the same for Part D. And you can see the first line here. If you found yourself in that base Part B premium paying the $144.60, you are not going to be required to pay any additional Part D premium. It's only people who the federal government believes are higher income earners who may be required to pay this. So you would get a bill from Medicare. Again, these amounts are per person and per month. So let's go back to that person who, I think we did a married couple with an adjusted gross income of $250,000. I think that was our example. So that is the third line down. That Part D IRMA would be $31.50. So if one or two of you are enrolled in a Medicare plan with that Part D, you would be billed by Medicare for an additional $31.50 per person per month. And what I didn't say with Part B that I should stop and say with Part D is obviously your income can go up or down. So maybe one year you need to sell a property or take a withdrawal from some sort of retirement account. Though any of those types of things that affect your adjusted gross income could affect how much you're paying for your Part B premiums or any additional Part D IRMA. Also, the closer you retire to turning 65, for my example of somebody retiring at age 70, when you're enrolling in Part B and D, you might have a look back that's an employment income. So if you retire at 70, then obviously when you were 69 and 68, you had you had an active employment income. It won't be a few years until things adjust down and they're looking at more of your retirement income. So we do find sometimes people who delay retirement may find they're paying a little bit more in their Part B premium. And then a few years later, when that look back is accounting for your retirement income, then your Part B premium could drop. So just keep that in mind when you're looking at when you want to retire. So there is also something, in addition to the Part D IRMA, there's kind of the flip side of this. Some of us may find in retirement that we are of more limited income and resources. And Medicare has something for those people. It's called the Medicare Low Income Subsidy. So this is for Medicare beneficiaries who are below certain income thresholds. They will get some premium help for both their Part D premiums and their outpatient copayments. So that is all administered through Social Security and Medi-Cal. So I would encourage you, if you do think that you're going to be in a lower income bracket in retirement, to go ahead and contact Medi-Cal. They have the paperwork that you can fill this out. It works out to somewhere around $30 a month, and that would help you offset your Part D costs. Once you've enrolled, each year you do need to re-enroll to revalidate that you are still at that income threshold, but that paperwork is sent out to you each year. Okay, so we're moving into more of the CalPERS Medicare enrollment process. So we've turned 65, we've gotten our Part A, we retired, we got our Part B. Now we needed to think about picking a Medicare plan and what's the actual CalPERS paperwork and their requirements. So in order to maintain your CalPERS health coverage in retirement, for those of you who are eligible for that premium-free Part A, meaning we know we're eligible for Social Security, you do need to maintain enrollment in Part B once you're retired and maintain paying that Part B. And then you need to pick one of the Medicare health plans that I showed you a few slides earlier. If you don't choose a health plan, they will default you into either your current plan. So if you're in Kaiser now, they'll default you to Kaiser. If you're in one of the PERS plans, they'll default you to PERS. If you're in another plan that doesn't have a Medicare option, you will be defaulted, if you live in that service area, you'll be defaulted into the United Medicare Advantage plan. But your retirement is an opportunity for you to change plans if you wish. So maybe you're in Kaiser, but you're going to be moving to Arizona, and you want to try out the United plan. That is an opportunity for you to do that. All of your family members that you're covering all need to have the same health carrier. So you can't be in Kaiser but have a spouse in United, but that is similar to their requirements today. And you're going to make your health plan enrollment through CalPERS. So you do all your paperwork through CalPERS, not through Kaiser or PERS or United. You send your paperwork to CalPERS. and then they send it on to us. And if we have questions, we will reach out to you with those questions. And you're not stuck in that plan. So if you're joining Kaiser, you're not stuck with us forever. You can change plans at open enrollment, or if you have a triggering or qualifying event. The main one that happens, I think, in retirement would be if you're moving. So again, that example, maybe you're going to move to Arizona 2 years after you retire. That move is a qualifying event to make a plan change. Okay, so here is the health benefit plan enrollment, the HBD 30. You will need to use this HBD 30 if you are making any changes to your health coverage in retirement, such as adding or dropping a beneficiary. And you'll hear a little bit more about this later in the second half of the presentation. I just want you to have kind of a look at this form. And of course, you can find this form on the CalPERS website. And this is another one of CalPERS forms. This one's called the Certification of Medicare Status. Again, you can find this form on CalPERS website, or you can call them and they will mail a form to you. If you retire before or at 65, 3 months before you turn 65, you, step 1, contact Social Security to enroll in Part A and B. And then step 2, once you get that Medicare card, you're going to complete this form and then you send it back into CalPERS. And that's all you need to do. You're certifying that you are eligible and enrolled in Medicare. You can see on the form you need to give them your Medicare claim number, and you need to put in both your Part A and your Part B effective dates. If you're going to continue to work beyond 65, this is what those people are going to do. So fit yourself into this box. You're still going to contact Social Security, remember, because you're going to enroll in Medicare Part A at 65. Part A is technically free. There's no additional premium to you. But then you're going to defer Part B, as in boy, because your coverage through CalPERS is primary. Then you can complete this ineligibility of Medicare certification form, and then you can return that to CalPERS. If you can see on the screen, if you go way to the bottom here, section 3, it says, I have deferred enrollment in Part B due to working beyond 65. So this lets CalPERS know you are following the requirements, you've enrolled in Part A, and you're deferring your Part B, and you want to continue your CalPERS coverage as an active employee. And then finally here, if for some reason, maybe you're over 65 right now, and you didn't talk to me before when you were turning 65, and you haven't gone to Social Security, you haven't gotten A, or you didn't defer B, whatever the case may be, if you're retiring after 65, you can contact Health Benefits. You've got the email address there, and you can request that they help you fill out this request for employment information. This is a federal form that needs to be completed, that essentially your employer completes and says, yes, we did have them employed, and we did cover their health insurance. Once you do that, then you can contact Social Security to go back and enroll in Part B. You won't have to pay that Part B late enrollment penalty. And then once again, when you get your Medicare card, you go back and complete that certification of Medicare status form, and then you submit that to CalPERS upon your retirement. And I think that this is one of my last slides here. This is the CalPERS website. I really want you to make sure that you're familiar with the website, both as an active employee or a retiree. It really is where all the information you need for all of your health plans is available to you. I work mainly with Medicare, so most of my time is spent on the retiree page, going down to health and Medicare, and then retiree plan and rates. There's a couple different things that you can see here. In the sort of the middle, the second paragraph there's a health plan search by zip code. If you want to know which plans are available to you, either as an active employee or retiree, you can click on that, type in your zip code, select whether you're an employee or retiree, and you will see which plans are available to you. So maybe that Arizona address, you type in the zip code, and you will see, no, sorry, Kaiser's not available out, in Arizona, but the United plan's available to you, and a couple of those PERS plans are available. So that's going to be one of your first steps. You can also scroll farther down, and you can do a benefit plan comparison. Again, that's a tool for you to use whether you're an active employee or retiree. It will show you all of the health plans compared one against the, well, not against, but they're all compared to each other. You'll be able to see which services are offered and what your co-payments would be. Also shows you what geographic locations the plans are in. You'll also see in the beginning of that if there's been any changes in that past year. You can also see on the side there's a link to OptumRx. Again, that's for anybody who's joining a plan other than Kaiser. So you might want to bookmark this page for you to go back to as a reference tool, especially for those of you who are getting very near retirement or near turning 65. And I think my last page here, I've got some phone numbers up. We are also going to send the phone numbers and the CalPERS web page that I showed you previously, and the Part B and the Part D premiums out to everybody who's registered with an email address. And that would conclude my presentation. I think, Katralia, I'm either going to turn it over to you to see if we have time for a few questions, or what you would like to do for next steps.
Okay, so yes, we have about 5 minutes for questions that may not have already been answered. If you would put that question in the Q&A. Okay, Sonia, would you please take over in this section?
Okay, so we have a question. Quite a few people are asking, do I have to enroll in Part A? I'm still working full time. I am over 65. We often tell them they don't have to. It's not necessarily a requirement, but I still get that question. Can you answer that, please?
So yeah, it is not a requirement for you to enroll in Part A if you're going to continue to work. We, and CalPERS as well, likes to tell people turning 65, if they're still working, to enroll in Part A, because then you also have to take that action to defer Part B. So it sort of ties things up in a bow. Then you can complete that ineligibility of Medicare. Let me just go back to that page right here. Then you can complete this form, and it's sort of done. So you've acknowledged that you're going to continue to work. If, however, you're already over 65 and you haven't done that, that's okay. You will not have to pay a late enrollment penalty for Part A or Part B. That's where this form comes in. This is where your health benefits can complete the request for employment information. So you could go ahead, once you've had this form completed, you can go to Social Security and you can enroll in A and B at that time. So no penalty, it's just nicer and sort of ties everything up if you enroll in A and then you defer B when you're turning 65.
Okay, I have another question for you. And it's
Sure.
kind of on the same lines. I turned 65 in July. I will continue to work for at least 2 more years. I will sign up for Medicare and Part A, but decline Part B. What form do I need from CalPERS to decline Part B? And I think that's what you were just going over.
So this one right here, and they should be sending you this and the certification, both of these forms, they look very similar. They should be sending you the certification and the ineligibility when you're turning 65. If they haven't, and obviously CalPERS deals with this every day, so you can call them and ask them, I want to enroll in A and defer B. What form do I need? They will mail this form out to you. It's the ineligibility of Medicare certification. And it's a little bit of a misnomer because it's really not that you're ineligible. It's just that you're continuing to work and get your health care through LACCD as an employee, so you don't have to enroll in Part B.
I have another interesting question for you.
Sure.
What if I, prior to retirement, I'm making $120,000 or I'm higher income, but maybe 3 years later, my income goes down. Will my payments go down? Let's say I go under $87,000. Will my Part B payments go down?
So that's a great question. So every year, the Part B premiums themselves change, right? So this year, the base is $144.60. Every year, it is a 2-year look back to your tax return. So in 2020, they're looking at, you would be looking at your adjusted gross income from 2018. Next year, in 2021, the look back is to 2019. So maybe in 2020, as an active employee, you had an adjusted gross income of, as a single person, $150,000. That would put you in that fourth line where you would pay $376,000. Maybe after you've retired, 2 years later, your retirement income is under $87,000. Then you would go down to that bracket. So the Part B premium amounts can change each year, and yes, so will you, where you are in that chart based on what your adjusted gross income was from 2 years prior. Does that make sense?
Yes. I have one more question. This will be all, and we'll go to the next one, to Karita's presentation, because I think her presentation will answer quite a few questions. But how does AARP fit into all of this? A lot of people get a lot of mail from AARP, and we just want to know how that fits in.
So AARP does not fit into this. AARP is one of many options, many health that have agreement. I think theirs is with United to offer health benefits to retirees. That's not something you need, because if you've met the years of service and the other eligibility criteria with LACCD, you will be continuing to get your health coverage through CalPERS. So I have up on the screen the various Medicare options. You'll be picking one of these health plans, and then they all come with Part D. So just like you may have friends who are self-employed right now, and they get their health coverage on what we call the open market, or the individual exchange. That's kind of what the AARP is for Medicare. They're kind of on the Medicare exchange, but right now you don't need that, because as an employee, you're getting coverage through CalPERS. Same with, if you've met the eligibility criteria, you would get your coverage as a retiree through CalPERS as well. So you wouldn't need the AARP coverage.
Thank you very much.
Sure.
Okay, so Julie, one last question here. It is a little bit off the beaten path here, but
Okay.
I have a person here that would like to know, they are receiving, they believe it's coming from CalPERS, a packet to ask them to complete month by month about whether or not they're on Medicare or not, and they have responded, but they keep getting it. Whom should they contact?
If it's coming from CalPERS, you should contact CalPERS. That's what I would recommend. Whoever is sending you that information, there should be a phone number that you can call. So if it's coming from Kaiser, you would call Kaiser. I don't know what that is. It could be something about your like a Part D, as in drug, late enrollment penalty, but do contact the phone number that's on that letter. If there isn't one, I would call the 800 number that I'm going to put back up on the screen here. So that 1-800-CalPERS. Okay.
Okay. Awesome. So we have about 16 other questions that I'm going to ask for the panelists to begin to answer while we move on to the next part of the presentation. How do you enroll initially into the CalPERS program for retirees and maintain your health benefits? We're going to turn this over to Karita Hughes, who's going to share a screen. And while she's pulling that up, please be aware that at the very end of her presentation, as we close out this webinar, there will be a survey. I'm imploring you to please wait for it to come up on your screen and then complete that survey for us. We need to make our webinars as good as possible, great as possible, and so we need your feedback. It's a quick survey. If you would complete that, we would greatly appreciate it. With that, I see that Karita has loaded her Retirement 101.2 slides, and please know that we had several questions as to whether or not you would receive the slides from this presentation. After the close of this webinar, yes, I will be able to retrieve all attendees' email addresses and then be able to send you the slides that I have available. So with that, I'm going to turn it over to none other than Karita Hughes.
Hello, everyone. I'm Karita Hughes. I work with LACCD Health Benefits Unit. Some of you have worked with me via email, via telephone, a few of you in person. So I just wanted to say hi to all of you and to start this subsidiary of the Medicare seminar. The first thing that is happening is that my computer is not working. So that's fun. With regard to resigning and retiring, what I occasionally experience, my colleagues and I occasionally experience receiving the application for retiree health benefits prior to you resigning or retiring with your office, with your location. We can't do anything when we receive that packet. I know some of you are trying to retire in secret. I know you're upset and frustrated and you want to just get out of here quietly. Unfortunately, what ends up happening is I have to blow your secret. I have to contact your office to find out if you did retire. So I'm asking then that you go to your local HR office, the one over your campus, or if you're at the district office at the district location, and request the Resign Retire packet so that you can turn it in to your local supervisor, school dean, or etc. The Resign and Retire packet does require several signatures from the supervisor, department chair, or department head, and school dean. So because it takes a little bit longer, especially now, I normally request that people at least start about 2 months before they resign, before they retire, to get that HR packet and start the process of retiring with their location. Again, if you submit this to us without doing that, there's nothing we can do. We can tend to hold it and contact the campus. This is the application for retiree health benefits. Whether you're an early retiree, meaning you're under 65, or if you're a 65 and older retiree, we require this from everyone so that we can, so that we'll know that you're preparing to retire. This starts us to doing certain things to check on you. If you're over 65 or if you have dependents on your plan who are over 65, we do require that you send us the email to fill in the request for employment verification. We fill this in. You don't fill it in. You shoot us an email. I will provide the email at the end of the seminar. You shoot us an email to fill this in and to send it to you and or your dependents. And we just send it to you, and you'll make the appointment to go down to Social Security to turn this in. Regarding health benefits vesting, there are two types of vesting. The first is for anyone who was hired prior to June 30th, 1998. All you needed was 7 years of experience and to be either age 50 or 55 if you're in CalPERS. And you must receive a pension from CalPERS. The district contributes 100%. There's a 100% district contribution towards your health benefits as long as you meet these requirements before 1998. If you retired if you were hired on or after July 1st, 1998, that's when we negotiated percentage-based vesting. What this means is you work 10 years, 50%, 15 years, 75, 20 years, 100%. You must also be the appropriate age, 50 or 55, depending on your the agency that holds your pensions, PERS or STRS, and you must receive the pension from STRS and PERS. In order to start your retirement, as I indicated, you do need to go to your campus, and this will be provided for you later. These are your HR contacts who will have the resignation retirement paperwork for you to take to your local supervisor, school dean, etc. And this will be provided for you later. It's broken down by campus so that you can start the process of getting the resignation paperwork. Once you've started the process of getting the resignation paperwork, you will come to the Health Benefits Unit. I have to figure out how to stop that thing from going up top. You will come to the Health Benefits Unit. The unit leader is Leo Costantino. That's in case you have any great compliments of the work that we're doing. You would write to him and tell him what a wonderful job the staff is doing. You would send an email. You would send an email to the Health Benefits Unit to get either your application for retiree health benefits or to get the Medicare waiver form that you will need for either you or your dependents, or if you have any general questions regarding health benefits, you would send an email to the Health Benefits Unit. There is something particularly for STRS retirees called the Express Benefits Report. Health Benefits Unit doesn't have anything to do with the Express Benefit Report. So when it's time to submit the Express Benefit Report or to ask questions about where it is in the process, have you completed it, etc., you will go to the Retirement Unit, and this is the email address for the Retirement Unit. Again, the email, this slide as well as the previous slide will be provided as part of a PDF packet later on. And my presentation very short if you have any questions, but the first thing is Karita Bot has some questions. Some of the questions that she came up with, Karita Bot, some of the questions she came up with have been answered today, but they also came from last week's seminar as well as emails that Karita Me received during the week after last week's seminar. So the first question that I received is someone wanted to know what it meant to be 50, 75% or 100% vested. The remaining amount is the amount that you're expected to pay towards your share of the district contribution for health benefits. So an estimated cost of a one-party plan, I couldn't do the two-party, three-party. The district is contributing $700 to the plan. So a 50% person pays his or her share of 50%, or a 75% vested person pays his or her share of $175, and obviously a 100% vested has no share to pay. Same thing If you are 65 and older, you're probably on a Medicare plan, so you're on a cheaper plan. But again, you're still expected to pay your portion of 50%, 25%, or 0% toward the plan for the cheaper Medicare plan. Now, the plan being cheaper seems like a great thing, but you have additional Medicare costs. So I saw in the chat, as well as I saw, I received questions, does percentage vesting mean that the district contributes toward the 50 to 75 or the 100% toward Medicare? The answer to that is no. You must pay the full cost of the Medicare plan. So then the question is that I received, if I'm paying the full cost of Medicare, then what is the district providing? The district Medicare is an 80-20 plan, which Julie kind of explained earlier. It wasn't meant to be all-inclusive, so you will have 20% of services that you would be expected to pay. Many people purchase something like a Humana or some other AARP recommended or suggested plan to cover that 20% gap. You do not have to worry about that gap. Our insurance covers that gap for you. So we become a supplement to Medicare, but you don't have to look for a gap plan or pay for a gap plan. Another question, what happens to my dependents when I go on to Medicare? We have 3 types of medical plans. The first is the basic plan, which means that no one on the plan is on Medicare. The second is the Medicare or the supplemented plan, which means that everyone is on Medicare. The final is called a combination plan, which means that someone is not on Medicare, someone else is on Medicare. 1, 2, 3 people in either direction, on or off. But the point is that you will all be on, say, the same PERS choice plan. It's just that some people will be on basic, some people will be on the Medicare supplemented portion. Same thing for Kaiser. Some are going to be on the basic Kaiser, where some will be in the senior advantage or the Medicare supplemented portion of the plan. I'm 65 or older and plan to continue working for a few more years. Do I need to sign up for Medicare? No, do not sign up for Medicare while you're still working. If you have dependents on your plan who are 65 and older, do not have them sign up for Medicare while you're still working. What happens if people try to sign up for Medicare while they're still working? You can sign up for A, as Julie mentioned, but please do not sign up for B. You find yourself, particularly with B, as you're having services, you find yourself in this circular battle because neither Medicare nor your primary insurance, your actual insurance, wants to pay because they're both looking and saying that you have this other coverage. And you tend to come to us and there isn't a lot we can do. So you find yourself having to try to ferret out this really difficult struggle between 2 large institutions. So do not sign up for B. Julie mentioned in the earlier slide, there are certain medical conditions where you're required, but if you do not have to sign up for B, please do not, or you'll find yourself dealing with a struggle to get someone to pay for the services. And at this point, Karita Bott has given me all her questions, so if you have any questions. I think I saw a question that I put in holding. The person wanted to know if he or she could continue to work after they became Medicare eligible, after they retired. So I do want to answer that question. With regard to working after you retire, if you work for a CalPERS covered agency, if you go to work for another public agency in the state of California, then you do not have to retire as long as their benefits are administered through CalPERS. When you're ready to retire, that's from CalPERS, that's when they will expect you to do the full-on retirement, as long as you're going to work for another public agency. If you're going to work for a private agency after you resign from LACCD, and you choose not to retire from CalPERS because you're still bringing in money from that private agency, from that job, you will lose access to your LACCD CalPERS sponsored benefits. So if you retire from LACCD, be ready to either go work for another public agency or be prepared to retire from CalPERS in order to maintain your LACCD benefits. Any questions other than that?
Okay, we have 12 questions here. However, Sunny Smith wanted to answer one of them live here. So Sunny, would you please ask that question, and then we'll get back to Karita. Sunny? There you go. Yeah, you're still muted. Let me see if I can help you unmute here. Are you able to unmute? There you go.
Yes. So
All right.
I needed your permission, if you will, to unmute, I guess. So I did not have a question live, but was there a question I answered?
Yes, I had responded to you. Okay, you could ask that question live. Maybe you had hit the button.
Yes, I probably
okay.
did it in there.
Okay. Let's see here. I'm just going to call out these questions as others come forth. One is, I turned 65 in July. I will continue to work for at least 2 more years. I will sign up for Medicare and Part A, but decline B. What form do I need from CalPERS to decline Part B? I do believe Julie has answered that for you.
Yes, that was the ineligibility of Medicare certification.
Exactly. Then here's another anonymous one. Also, my husband applied to Medicare A, but he is covered by my insurance. Does he need to use the Medicare in conjunction with the health insurance? And that is what
He doesn't. Okay, go ahead.
Yes,
Sorry.
Karita was alluding to the battle between who pays primary, right? And
yes.
so,
Correct.
Sunny, go ahead, Karita.
As indicated, it's a battle between who will pay. Fortunately, Medicare A is hospitalization. So it is not something that you use every single day. It's the Medicare B, which is services. That one is a little more struggle. What happens now is that if your husband were to ever need to use hospitalization, that's where you'll experience the battle. But our insurance is supposed to be the primary payer, the first payer for any hospitalization issues that he has, and then Medicare becomes the second payer for hospitalization for Medicare A usage.
Okay, at this time.
At this time.
Yes, okay, while they're still working. Okay. Another question, as an adjunct, I think enrolling in Medicare is less money than I pay through LACCD. Please address that.
It will be up to you to address for the financial, because it has both financial and health care administration issues related to it. LACCD does not really do cost analysis. So you would do the comparison between the two plans, the LACCD's active plan and Medicare. You would make the decision as to what is a gap. You would have to do that very active, detailed research because LACCD cannot take the responsibility of providing cost analysis for something where maybe if you are not happy with the services, then we become responsible for having guided you in that situation.
Oh, I see. Okay, so we have another question. My current plan is PERS Choice. So it means that I don't need to choose any Medicare plan for PERS care during open enrollment, but to specify that in the retirement request form, such as HBD 30.
I'm not 100% sure I understand, but from what you're saying, you currently have PERS Choice, and am I to understand that you might want to switch to PERS Care at retirement? You're the only one.
I'm not sure. He's not clear in how he wrote this. So if you could provide us with that in the chat, we can get a better answer for you. We need a clarification on that question.
Okay, so let me just answer a very specific matter then. In your current plan, if you retire happy with your current plan, then you do not need to do the HBD 30. You want to stay in PERS Choice, you want to do something like that. If during your retirement you're making the decision that you want to switch to a different plan, then you do the HBD 30 to switch plans. Another thing I pulled from that question is open enrollment. If you're retiring this year, then you can, if your retirement is going into 2021, then you can disregard open enrollment. You don't have to make any plan changes or do anything like that, because when you're retiring, that's the life status event that will permit you to make plan changes or to just continue as you are. So I hope I answered the question as specifically as I can with that general question.
Quite well. We have a question here that says, how do we know if we paid into Social Security a sufficient amount of time or dollars to be able to receive retirement health benefits? Does the windfall have an effect? I believe they're referencing the Windfall Act. I've worked as an adjunct for LACCD for 24 years and am not sure what my eligibility and benefits will be.
You will have to actually contact the Social Security Administration. And the reason I say this is because many faculty members had the option prior to 1986. Prior to 1986, many STIRS or DB, CB, adjunct faculty were on CB or STIRS. They had the option to choose whether to pay in Medicare or not. And I think many chose not to. In 2001, we did a Medicare election that we didn't address adjunct faculty. So I'm going to tell this adjunct faculty that he or she needs to go directly to Medicare to see if he or she chose to have the Social Security deducted from the check, because they didn't always have to, and I'm not smart enough to do the math to know if 24 years ago was before 1986 or not. After 1986, anyone hired after 1986 didn't have an option. We just took the money out of their plan for Social Security and Medicare. We just took the money from your warrant.
Okay. All right, here's another question. I will be 65 in November and I am not planning to retire anytime soon. Should I just wait till I hear from CalPERS, and should I contact the Social Security office? I believe that has been covered. Is there any additional information that we should give this attendee?
No, it's
Okay.
apply for A and you can actively waive B, as Julie indicated earlier.
Okay. How does one pay the additional amount contribution to the district? That's an anonymous one. Additional amount contribution. I'm not quite sure.
Oh, are they talking 50% vested?
Oh, yes, that's what, okay, yeah.
Okay. If you're partially vested, what happens, the district obviously pays this amount, and CalPERS and STIRS will take their, the contribution for your portion out of the STIRS or PERS pension. With regard to dental and vision, we've actually set up a plan where you'll pay by check monthly, yearly, quarterly, whatever you want to do. But for medical, it comes from your pension directly.
Okay. Okay. If you retire with 5 years and are over 70 years old, can you purchase PERS Choice or PERS Care upon retirement and pay the full cost? They will not have vested. All right. All right.
Yes.
Okay. When you talk about the gap pay, are you talking about the 20% of the Medicare Plan A?
Correct.
Part A? Okay.
No, the gap is the 20% of Medicare in general. So it includes both Part A. If you have $100,000 of hospitalization, then you're responsible for that $20,000 because Medicare is 80/20, as well as services, which is B, is 80/20. You're responsible for that 20%. Well, because LACCD provides a plan, you're not exactly responsible for it, but LACCD would cover that $20,000 as well as the 20% of any other gap for services.
Okay. The next one is an interesting question. I have left CalPERS and now I am in CalSTRS. How do I calculate my retirement benefit?
That sounds like a pension question.
Yes, it
and
does.
that would be the retirement unit. That one of the emails that one of the slides that I had earlier, and again, Katrina will send the contact slides. That will be something that you would direct to the retiree unit.
Okay. Let's see. I believe this is in regards to the retiring and going back to work. What if you don't retire and start your own business and are over age 65?
When you say if you don't retire, you can continue to work, but you must, in order to maintain your medical benefits, you must retire from CalSTRS or PERS. So you can continue to work in any capacity outside of whatever you want to do, including starting your own business, but you should be receiving a pension from STRS PERS.
Okay, and so the piggyback off of that, if one stays working in the public agency after they retire, is that what is required if they move to another CalPERS organization? Is that required after age 65 in order to maintain their LACCD benefits, even if it's a part-time job?
If it's a part-time job and is not benefited, then you will lose your pension. You will lose your medical from LACCD. If it's a benefited part-time job at another public agency, then you don't have to retire. Did that answer that question?
It does. Someone wants to know if they can go back to CalPERS.
This might be a Julie question. CalPERS what does he or she mean go back to? Meaning
So they were in STRS, they were in PERS, they went to STRS, now they're going, should they go back to CalPERS to maintain their health care coverage?
You don't need to go back to maintain your health coverage. As long as you're as long as you're working for LACCD, we recognize both PERS and STRS. It's up to you whether you should go back for any other reason, and that's something you would address. The how-to was something that you would address with the retiree unit.
Oh, Julie, here's a question.
Okay.
I have friends in original Medicare Part B, and they are paying much less than the CalPERS premiums through an exchange, and they have Part B, which is called F coverage. It is with the Anthem PPO. It includes gym membership. Why are the district's plans or the CalPERS plans so much more expensive?
So the plans offered through CalPERS are group plans, and they actually have much richer benefits usually than this. I think it's a Plan F. I think you said it was through Anthem. Those are individual plans. So you'd actually have to look at the co-payments the out-of-pocket maximum and the coverages for each thing and compare them side by side.
Yes.
Related to the gym membership, all of the CalPERS plans do cover a free gym membership. Although right now, I don't know about you guys, but I'm not going to my gym. Kaiser has Silver and Fit, which gives you a free gym membership, a free basic gym membership with the participating facility. And you can go to silverandfit.com and type in your zip code. The other plans all offer silver sneakers, same concept, free basic gym membership. I believe both of them also offer at-home kits. I know Silver and Fit is doing like either Facebook or Instagram workouts. But you need to look at other things such as with CalPERS, there's no cost for your hospitalization on any of the plans right now. I don't know about that Plan F. Also, depending on how many years you have with the district, you're probably not paying very much for that premium. That is a benefit of your employment with the district, that they may be paying, some or all of that benefit.
Wow. Okay. I have a question here. If I choose Kaiser Senior Advantage, my vesting percentage doesn't come into play. I just pay the monthly cost from CalPERS.
Your vesting percentage does come into play. Kaiser Senior Advantage simply means that the person is on Medicare. The Kaiser Senior Advantage approximately is $400, and that's where the district will pay it's 75% or 50% depending on what it is. The district does pay its portion for Kaiser Senior Advantage.
Okay. Individual says, I have original Medicare. Do I need to be in a Medicare plan with Kaiser or just Kaiser HMO only? If I have Kaiser HMO, do I need original Medicare anymore?
Julie?
You do not.
I'm sorry?
This is Sunny. So if you have a Kaiser plan, what was can you repeat the question? I'm sorry.
It says I have original Medicare. So do I need to be in a Medicare plan with Kaiser or just Kaiser HMO only? If I have Kaiser HMO, do I need original Medicare anymore? So it sounds like they're paying both. They're paying into original Medicare.
So they would need to have original Medicare to be on the Kaiser plan.
Right.
So if they're on a Kaiser senior plan, they would need to have Medicare. So yes, you would need that to be eligible.
Okay. Let's see here. I think some will actually reach out to the health benefits. Someone has a question here regarding vesting. Working 13 years, will medical benefits be vested at 75%?
For 13 years, medical benefits are vested at 50%. Usually if I'm talking to someone who has something like 13 or 14 years, I actually try to talk them into staying around. But otherwise, it's only at 50%. We're only on the 50, 75, 100% schedule.
So they would have to have 15 years of service credit to vest for the 50% contribution by the district.
Correct.
At
the 75%.
The 75, I'm sorry, yeah. Okay, 75. Okay, I believe that I have covered the questions, and okay, yes, they've all been answered. With that, please, as we close out, I want to remind you of the survey that will be sent to you. Also, as soon as we hang up the line here, and we end this webinar, please hang on and complete that survey for me. Also, I want to just again thank Kaiser Permanente. Julie and Sunny, thank you so much. Also, the Health Benefits Unit, Sonia, Charday, you have been fielding those questions so well. Karita, thank you for your presentation and the little tweaks you made to it are so cute. Leo, I'm going to turn it back over to you to close us out, and then we will end this webinar.
Well, what can I say, Catralia? Another quality and informative production. Special thanks to our healthcare partners, Sunny Smith and Julie Brady. You guys are just amazing in sharing this information with all members, not just Kaiser members. And for everybody who joined us today, be on the lookout. Catralia is going to continue to develop some informational materials. Some are having to do with supporting us all during these difficult times. Others will be for the upcoming open enrollment. So keep an eye on your mailbox. There's more goodies to follow. Thanks, everyone, and have a safe weekend.
Bye-bye, everyone.
Okay.
Have a good
Thank you,
weekend.
everybody.
Have a great
Yeah,
weekend.
bye.
Thank you.
Bye-bye.